Hello and welcome. I'm Dr. Adam Dorsay, a psychologist in Silicon Valley and the host of SuperPsyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. SuperPsyched is your tool to get more of what you want in your life and less of what you don't. Grief is personal. How we respond to it, what works for us as we grieve, and how we move through its stages varies from person to person. And grief is not a diagnosis. It's a normal response to loss and not a form of mental illness. It may be useful to think of grief as love's souvenir. Dr. Adam Kimowitz has a thriving dental practice in Denville, New Jersey. He is a leading voice in his field, and he gives presentations to dentists nationally. In addition, and certainly not by choice, Adam knows the world of grief very well. 7 years ago, Adam's younger brother, David, was murdered. David was a great person, and Adam and he were extremely close. We talk about how his loss affected Adam as a brother, father, son, husband, and as a dentist. You'll hear what helped, what didn't help, and how he's doing now, as well as how he helps friends during their times of loss. It's a very intimate conversation, and since grief is such a personal experience, when you hear what worked for Adam, you may find yourself thinking, that's not what I would need if I was grieving. And that's exactly the point. What worked for Adam worked for him. What you find works for you is similarly personal. But you can use his wisdom as a primer to ask yourself what works for you. So listen in as Adam and I talk about the personal nature of grief. Dr. Adam Kimowitz, who has asked me to call him Adam, welcome to SuperPsyched.
Would it be really lame to say I'm super psyched to be here?
It would not be lame.
Yes, the Adams, absolutely.
The Adams are talking, man.
Yes, sir. So excited to be here.
And in this case, I would say Adam squared because we are greater than the sum of our parts as we fuse and work together.
Absolutely.
My man, I'm so grateful that you're here. So let's start with you introducing the listener to your brother David and a bit about you and your relationship with him.
I am a dentist from New Jersey. My father is a dentist. And interestingly enough, grew up with three brothers, 7 years apart, Adam, David, and Richard. We grew up in a pretty cool house. Not that we got lots of stuff, but my parents really reinforced like that closeness of brothers to the point where like we did everything together. But as we grew older, we ripped on each other through love. We had that kind of bond, that kinship where like, if we did something stupid, we would be called out for it, made fun of in the most loving way that we just laugh years and years and years later. And that true level of connection is, you can't package that. It's just something you feel. It is something you feel in your body, your brain, like in everything. It carries you. That's how my dad, he's also a dentist, and that's how he practiced as a clinician, right? It was always like, if somebody was a member of my family, what would I want for them? So for me, I've learned the science of what I've done clinically, how to make good diagnosis. Yeah, there's always a diagnosis, but how do you treat people? The human side of it, right? It's not just input, output, making a tire. The subjects of our care are humans. They come in all sizes, shapes, forms, personalities. And how can we get them from one side to the other across a threshold? So I started a corporate job, left that corporate job, was not for me. That world wasn't for me. And I said, I really want to do something where I have some agency from a caring perspective. I can earn a living, but also be there for my family and be really proud of what I did, because my dad gave this to me and my brothers, and I want to do this with my kids. So I felt much more connected to the work, the effort of getting there. So I kind of left a big corporate job at PricewaterhouseCoopers, which I don't want to say I was good at, but I was successful at. I could play the politics and the game, but it just didn't feel like me. Like if I fast forward 30 years, I'm like, I'd be the most successful, miserable person I'd ever met. Just not me. So left PwC, went to dental school, and actually I ended an engagement. And then I moved in with my brother, David. We lived in Hoboken together. We did everything together. And the kind of dentistry that I do is implant dentistry. And the people I see are broken. there's a diagnosis called terminal dentition, where people, it either affects them physically, mentally, functionally. So when you're so disconnected with something, when you look in the mirror and say, this isn't me, these people come at me, and I'm not a mental health professional, which I wish I had that as a dual degree because it would have helped me navigate the space. But these people truly are broken. And when I don't want to use the word repair them, but when we treat them, they feel like I am the true self that I've always wanted to be and manifest. Life-changing type stuff. And I don't want to say, I love using the term, I'm DMD, not GOD. Mistakes, I'm not perfect. But what I am is accountable to them physically, biologically, but also emotionally and mentally. So there's a huge amount of empathy, compassion that I have to learn to read people and understand people. So my father and family, we've always been about the feels. And I feel that way towards my family. So in 2019, I'm down the shore right now. It was a Friday night in 2019 in August. I was with my mom on Friday night, and we were talking about how grateful we were for the family that we have and the bonds that exist, and my children, David's children, Richard's children. And then when I woke up in the morning, I get a call. My dad said to me, you need to come upstairs. And like, I was kidding around. I'm like, okay, who died? He's like, no, you really need to come upstairs. And he said to me, we've been trying to get in touch with David and we think he's dead. It didn't register. Are you messing with me? It just didn't register. And throughout the day, it was kind of, we learned it still was in this kind of sense of disbelief, was in total shock. And when my brother had been murdered, somebody broke into his house, stabbed him. I don't know if you want to know, 27 times. There was a nanny living in the house, and the nanny's boyfriend had a key, gained entry, neutralized my brother to get to her, and he killed her too. There's still a trial pending. I don't really want to talk much about that because it's legal stuff. I just don't want to talk much about that. But as you can imagine, when you have a physical connection severed to someone you love, it's unfathomable. And to even make matters worse, the first person I called was one of my best friends who a year later dropped dead of a heart attack. So, I mean, you keep going and going and going and going. It's just, oof. It's one of the most unfathomable things. I just had to learn how to live again. Like, it's funny. I lecture frequently to a lot of dental audiences, and I teach dental implants. And I had an opportunity for a few years later, once I was able to pick up the pieces of dealing with complicated grief, I show a scene. I do a talk called Murder, Resilience, and Dental Implants, because with dental professionals, lawyers, attorneys, mental health, anybody who deals with the public, how do you go back to work on a Monday when your life as you know it has fundamentally changed? So I show a slide of Goldfish, the snack. My son Nathaniel asked me for some Goldfish, and I went to grab it maybe 2 days after David died and picked it up, and they all fell on the floor. When they fell on the floor, I tried to pick them up, but as they fell on the floor, I broke down and just lost it, cried, just like literally couldn't even pick up the Goldfish. The task of picking up Goldfish seemed so insurmountable. Normally, spill Goldfish on the floor, pick them up. It was just the task seemed like literally Kilimanjaro at the time. I show a slide and I talk about I was taken out by a box of goldfish. And then I realized if I can't pick up goldfish, how the hell am I going to even get to work, resume? I don't know what normal life is, but just resume anything. And I realized I needed a lot of help. And I have best therapists in the world. I have great anchors and great people. I mean, I wasn't going to fix it in one day, but I started to develop these concepts of micro wins, little micro wins, meaning like if I can get through a day for the first week without throwing up, that was a win. If I could take a shower and then decide what color shoes I'm going to wear, that's a win. I mean, I set the bar to myself. I don't want to say so low, but it was basic functioning. If I could get down a meal, if I could put on a baseball cap, I mean, simple things that got me to the point where if I could get to work, and it wasn't like go do surgery, but it was kind of on this like numb autopilot mode of, is this real? Is it not? Eventually, I don't want to say I found my way out. I found my way through it. And what I realized is I can't do this alone. I really needed to learn from other people who are professionals, who've had similar experiences. So again, like I joke around with this, like, but if people collect baseball cards, I'd love to collect like therapist cards or thinker cards. We have Frankel here, we have Brene Brown there, we have Adam Grant here. I mean, like, so for me, I have studied some of the most brilliant thinkers in the world. Plan B, right? Sheryl Sandberg, all these things, not the same. So what I did is I said, okay, I just wanted to learn and accept. The hardest part was accept. Like, so learn about this great, I wouldn't say call it a great thing, but Kubler-Ross, all this stuff. But I said, if I can not necessarily fix, but understand and just emote of what I'm feeling as much as possible, maybe it'll be helpful. And there's so much involved in that. Not only the complicated grief, it was traumatic because I didn't feel safe. I mean, literally that night, I felt people were going to come into my house and attack me. All of that stuff. I had a PTSD trauma response to all of it, became hypervigilant in certain ways. It's who I am now. I accept that, but I would not wish it on anyone, first off. But I also want people to know where people would love to compare one grief versus the other. I call it the grief Olympics. It says, well, why does my grief get elevated and is better than yours? Like, no, like pain is pain, grief is grief, but it's not like, well, you have a 6.8 on the grief scale and she's got a 7.2, so you get to get first in line at Disney. No, but it can coexist. It's not a either or, it's an and. We have responses to pain and grief. We have coping strategies or really bad maladaptive coping strategies to all of it. And pain can manifest from something like, they put too much sauce on my pasta, I can't handle this. But at the end of the day, it's like how our nervous system processes these things. Our brain as an operating system processes these things, and how our body biologically responds to these things. There is a stress response, as we all know. There's neuroplasticity. All of these things, they are connected in ways that, I want to understand, but even some of the most brilliant thinkers in the world don't understand. For me, it's like whenever I feel lost, my fallback is to try to learn, listen, and acknowledge, realize maybe I can look at this as an opportunity to grow.
So you're talking a bit about the overwhelm, the deluge, the stages of grief. You kind of referenced Kubler-Ross. You're talking about the PTS response, which is very understandable. Can you kind of give a list of what helped and what hurt during the acute phase of learning and grieving?
Honestly, what helped most for me, and I'm going to talk on various levels. First, the acute of this is shock, right? When people are in shock, there is no right or wrong way to grieve. There is no right or wrong response. Some people laugh out of nervousness. Some people cry. Some people just go and talk normal because they don't know how to respond. I think at this time, what was most helpful for me was literally not resorting to suicidality. I mean, like saying to myself, like, don't drink, don't smoke anything, don't do anything that would really alter your mental state. From the standpoint is that I was so vulnerable, I needed somebody around me 24/7. And I said that, like, I don't trust myself. I'm not saying I was even suicidal. It wasn't even that way, but I've never experienced a murdered brother before. I've never experienced anything that was unfathomable. It was the most effed up, insane thing that literally I would either need my wife with me, I would need Jed with me, I would need a friend. I just did not want to be alone, and I wanted to be around safe people. So like in that first moment of anything bad having, that you have a special connection to a friend, if they ask something of you or you ask something of, you say to them, like, listen, I don't want to presume you do or don't need this, because a lot of people like to tell me what they thought I needed. Like, in a way, just be there. In that, also in that moment, to not want to just be defined solely by that grief. Like, laughter was very helpful. So like telling a joke, we can have bad things, but we are many, like Dick Schwartz wears a lot of parts to us and they're still there. Maybe they're a little latent, But I felt guilty in the beginning for laughter. When I say in that first 24 hours, but then like literally Tuesday night after my brother's murdered, we were sitting with his casket in the funeral home, me and Richard and Laura. And then like one of the things we said is like, David would love this. And we just started laughing and telling David jokes, literally laughing. And that's so funny because my brother originally wanted to, maybe was thinking about being an attorney, maybe a rabbi or something else. He ended up going to real estate, commercial real estate in New York. But what he ended up doing out of sheer love, because he was so connected to it, he became a comedy producer. And then from a comedy producer, he opened up a comedy club. And then from the first comedy club, which was in Union Square, he opened up one of the largest comedy clubs in Manhattan called The Stand. And he was the comedy producer for Jimmy Fallon. He was the manager for Big J. Okerson. I've met some of the most unbelievable comedians like Chappelle, all these like crazy comedians. And like he was able to see something about these guys. Their job is to bring people together, laugh, make them feel really good. But that was one part of it. But he saw the human side. It's a hard world. They're up on stage. If people respond a certain way, that means success, or if they don't. And their craft is a unique craft. And he just was able to not just be like, how much can you put out there, Mr. Comedian or Mrs. Comedian, and get me paid? But he really dove into their lives. Tell me about your family. Tell me about your mother, your kids. What do you like? What don't you like? And he became so connected that a lot of the folks in this comedy world felt like David was their mother. Like really, he just had a way of connecting and saying, you're good here, and getting them the best deals and making sure they didn't get screwed. And he was kind of like the breath of fresh air, not just kind of like that private equity, how much output can you get? But like he just had that unique seeing the best in people. He always saw the best in people. He always knew how to extract maximum fun. He always also never took himself too seriously. Like him and Jed used to love to rip on me. It's
funny. I got to see the three of you in action. I saw you, David, and Richard, and I was blown away by the vibe. I mean, the energy of the three of you, the strength of your connection, the common denominator of laughter. The three of you were laughing almost like you were a chorus of brilliant laughers. Yes. And I didn't spend much time with you guys, but I was absolutely knocked on my ass by this because it was so powerful. Yeah. And then your dad shows up, and then your mom shows up, and it was like a quintet of laughter. And you are one of the funniest people I know. It's interesting to note that my grandpa Abe was a dentist in Newark.
I have a grandpa Abe as well.
That's amazing. So we have all these, I mean, not only are our names Adam, but you know, I'm named after a dentist, and they didn't want to call me Abraham, so they called me Adam. But here's what I want to throw out, and that is when I was traipsing through Eastern Europe, I get a call from you, and you said, Adam, I have a story for you. Yes. I need for you to hear about this.
Yes.
And I just died laughing, as I often do when you bust out any material, because you are, by my standards, ridiculously funny. And I want to talk about just that continuity. Kiko Veneno has a song called Reír y Llorar, which means to laugh and to cry. And these are on the same parts. I mean, you can be crying one moment, laughing one moment, and then going back to crying, etc. And you told me two stories about grieving and laughter that were so good that I just needed to share them.
So David's best friend, who has also become one of my best friends, so it's been that way. We grew up, and he was like another brother to us, brother from another mother. His mother passed away a few weeks ago. And one of the things that I learned about grief in my own experience, it makes people really uncomfortable. Kind of, there is that ick factor. It's like, we don't know how to handle grieving people. Like they're almost kind of like this lepery, like a leper. How do you, people say, either don't say things at all, or they say stupid things. Like, it's like, oh, they're in a better place, or this is God's plan. I'm not saying all those. And it's like, however they want to feel better about themselves. It's more like, how do we approach someone in mourning? There's just this general discomfort. So I called my friend, and I'm not going to say, you know, my condolence, which is fine. My way of is treating them normal, you know, treating them as I normally would. And I'm like, dude, I just wanted to reach out. Listen, this is not a call I want to make. not the one you want to get. And this really sucks. I said, but you need to know one thing. People are going to say some crazy stuff to you. But before that, I need you to know I'm there for you. And by doing this, I am prepared to come over right now. And I'm not going to say exactly what I said verbatim, but do something really disgusting and inappropriate to you. Like really disgusting. Like
this would be on brand for the way the two of you would ordinarily
100%.
talk. So
like,
it was not.
Yeah. Typical banter. Like
just to let him know in some ways, things are still normal. Yes. Even though they're absolutely not.
Right. Right. Just we have that in the tent language that brothers have, fun things that you would never say professionally. You would never want to offend anyone, but you know there is safe, that concept of psychological safety is there with your best friend, that you could pretty much say anything and be yourself. Well, I said anything and then some. And then what I didn't know, he's like, Adam. I'm like, what? He's like, Adam. I'm like, what? He's like, you're on speakerphone. My wife, my children, your parents, we're making funeral arrangements. And I'm like, the only thing missing was like the rabbi, right? Like there's a whole
that'll be in the movie version though.
Yeah. And I'm like, oh my God. And like, all I could think of was like, this is amazing. I'm already committed here. This is great. This is like so on brand for me. But he's like, the next day at the funeral, he's like, that was such a gift you gave me. I said, what do you mean? He's like, it was the best part of my day. You broke up the tension. It was so much fun, and it made me realize who I was in the midst of the worst possible thing, that we can still laugh. And I experienced that myself. So at my brother's funeral, there were about 2,000 people there. It was insane. My brother, again, would have loved that. He's like, yeah. It showed how many people loved him, how many people he connected with, how many people he touched. And it wasn't just because the grandiose insanity of the situation, but he really had an impact. I honor him to this day. That event didn't define him. Like he's so much more than that. But like during that day, again, I could barely move, barely function. I had a really close friend. His name is Justin Moody. He's a dentist out in Arizona, runs one of the largest educational institutes. It's called Implant Pathway. And I just love the guy. He's just so real, so human, one of my dearest friends. And he basically sends me a text during the funeral. For some reason, I had my phone. And he's like, dude, it's really hot in here. You seem to be on the VIP list. He's like, you seem to be really connected. You think you could do something about the air conditioning situation? And he totally knew he was messing with me. I just started laughing because it's like, you don't say that to like the person that's about to give a eulogy.
The worst day of his life, literally.
Right. But he knew exactly what I needed without telling me you need this. He knew my sense of humor. He knew who I was. So it's like, it was just so healthy and so real that the ridiculous, it's like biting that lemon. It's that like synaptic jolt that you just need to break yourself out of it. And I know like when Brett Frank was on the show, she said, bite the lemon when you're stuck, like all that. But there is neuroscience to this. There are certain things that get you unstuck, whether it's in a moment or in a rut or whatever. So I've studied these things. So you asked earlier, how do I get out of this? I'm still getting out of it. But it is understanding the patterns, understanding what, and then understanding the connection points and the disconnection points that lead to being yourself and being more aligned.
And without being too presumptuous, I don't think the point is to get out of it. You'll probably never get out of it. It'll always be there. And yet, dear listener, what Adam is describing were two interventions that were perfectly formulated for him. It might not be formulated for you in the relationships you're in. It might not be formulated for everyone. In fact, it isn't formulated for everyone. It was personally tailored to you, and you personally tailored it to your friend who you knew would get the joke and would receive it well in that tough moment. There are multiple gems that you threw out, one of which is when somebody is trying to provide consolation to the bereaved. They often will throw out something like, oh, the person's in a better place now, or the I know exactly how you feel. There are certain things that maybe you don't say. And I'm wondering, like, can you give a primer on, besides the incredibly hilarious bits that really not everybody could conjure up, but what are some things that a person could say? I've even heard some people say that they don't want to bring up the loss. Like, no. And I've heard people saying, if you do bring up the loss, it'll, of course, bring up some of my sadness. But if you don't bring up the loss, it will break my heart.
So a couple things that people can do. If you don't know what to say, the best thing to say is, I have no words. I just want you to know I love you, or I care. And I'm here with you to help you carry this in any way that I possibly can, right? It's, I love you. Very just simple. It's not a teachable moment where you're going to teach them that because of your grief. It's just, I don't know the right words to say other than I care for you. And if they will allow you to hug them, hug them. That connection, that moment of connection is everything to an individual. Another thing someone can say, to your point, don't ever try to say, I understand your pain, I know how it is, or I had something similar and my uncle, like that's not what one wants to hear. Another thing that you could say is, I'm so sorry, but I want to understand, like, and if you're comfortable, tell me more about this person. Because what you do when you ask somebody that, you're inviting them to make that person alive again. Not dead. You're not focusing on the death, the event, the grief. You're getting that person to honor their soul. That's a very inviting. So to your point, it's a very inviting. So I love when anybody says, tell me about your brother. Tell me about Dave. I love talking about Dave. I love talking about my brother. Why? It honors him. It makes him alive. Maybe not in body, but in spirit. I love it. I am a big journaler. I write. I look at things through that lens of, what would Dave find this ridiculous? Because I know him. So I think make that person alive. Tell me about it. Tell me something that I don't know. If I don't know that person much, I think that's a really healthy, not everybody wants you to be a therapist in a moment of grief. They want you just to be there and present, just showing up. And I think for people too, because it makes them uncomfortable, they tend to presume to know what you may or may not need. And grief is, I'll tell you this right now, the experts, the non-experts, the people who study grief will tell you that grief is such a unique individual expression and that everybody manifests it different. There's no right or wrong way to do grief. Some people respond so different. And that's where people tend to feel guilty for grieving themselves. We do self-harm at times for, I shouldn't be doing, or I should be okay by 7 days, or shouldn't. And then people will like to tell others how they shouldn't and judge them, especially intra-family issues. Families tend to get destroyed. My family has not. We talk, I think. And if you don't know, like one of the things I've submitted to know is that I don't know. There are people trained to help you through these really tough situations, whether it's from mine or even a relative gets a cancer diagnosis or any type of point of disconnection that just makes you feel like the world is falling apart, that you are human. This is a part of the human condition, unless you're a total sociopath and have antisocial personality disorder. And if you have that, sorry, can't help you. Nobody can help you. But if you do have any ounce of feeling of getting some type of disconnection, that you are not alone. If you're a human being, everyone else has been through it, but we all express it differently.
What I love about this, Adam, is you're basically taking the pressure off the person who wants to provide comfort and letting them know, listen, you do not need to be the great bard. You do not need to be some incredible grief specialist. All you need to do is say that you're with the person and that you'd like to get to know if the other person is willing to share some stories about who they're grieving. That is more than enough.
Yes. So it's funny. Another friend of mine, a family member, died last week. And what I said was, same thing. I said, Evan, his name's Evan. I said, this is crazy. I said, I love you, bud. And I care about you, but I got to share this story with you. And I told him the story about the inappropriate piece. He's like, that changed my day.
The inappropriate text that you got from your buddy?
Yeah. I shared him the inappropriate text and also the one where I was on speakerphone, right? I think
so good.
In grief, people want to feel, they are maybe defined by that grief is kind of all consuming. They're drowning it, but there are also so many other parts, right? You look at those parts of people, we are still those people. But that part, that grief part, maybe surfaces up and is a little bit more concentrated, but there's a lot of it doesn't cancel out the other parts of who we are. We're still friends, husbands, wives, cousins. We still have those parts. We have professional parts. We have all those parts that are still there. Maybe that professional part's going to be put away for a couple of weeks, but they're still there. they can still be recalled, maybe inappropriate, certain things, appropriate or inappropriate, but we're still human beings. And I do believe that people grieving aren't lepers, but it's such an uncomfortable thing in society that dying is just as much of a life event as birthing. And that we, especially in Western society, we just don't know how to handle it as well. I'm not saying all of us, it's just culturally a little bit more of a taboo subject than, say, a birth. People love to go to a birth. People love to go, when I say not the actual event, but like a baby shower.
Right.
Or, like, we're not going to all have a birthing party, but it's a very happy. But grieving, it's funny. I don't know who said this. There was a TED Talk that said, scientifically proven that anyone that you know has a 100% chance of dying. It is fact. So either you're going to go first or I'm going to go second, but it's just a fact. And if you have any degree of connection, then that's something that we have to learn how to have these conversations with our children, with ourselves. And not that you're going to beat it, but coexist, understand, and give ourselves and others grace in these moments when the human connection matters most. Really.
And I'd like to get into, such good stuff you're sharing. And again, listener, we all, as Adam mentioned, we all grieve differently. Some of us may not want to talk about the person that we're grieving, and that's fine too. But I think that fairly universally, although I'm sure it's not universal, because as you said, it is so personal, the idea of I'm with you, I'm here for you, I love you. Here's another challenge. Adam, you're a father, you're a husband, you're a son. You are also a very high achieving dentist, and you had to perform all of these roles. Let's start with father. You had a 6, an 8, and a 10-year-old when Dave died, and they were grieving their uncle, and they were also seeing their father and their mom in an unusually torn up way. What are some of your just nuggets for parents who also have children who might be affected by death?
This is a tough one because what our instincts may tell us may not necessarily be the right thing. There's a couple things that I think ring true. First is be as honest and as open as possible. And if you can't, don't lie, but just say, I don't know what to say, but we're going to talk about this. If you're frozen in grief in the acute moment, that's fine. But I think kids are smart. They're resilient, and you have to tell the truth. And that's about creating psychological safety, because grief in children is different than grief in adults, and it manifests at different stages and at different times. So I think for children, I think you just have to be honest with them, creating a time where you just shut up and say, what questions do you have? What questions do you have? I'm going to tell you what happened. I don't necessarily need to get into the gruesome details of what happened in my family, but Uncle David is no longer with. It's unnatural. We're all really sad. We're really sad. And I don't think we should hide how we feel, because feelings are an expression of humanity. And I think for my kids, what has carried them through, and I think my family is even closer, is that we talk regularly and we listen regularly. And then we solicit help from professionals that are trained to do this. For me, I am an intellectual. Like when I say intellectual, I intellectualize everything. I am cerebral. I'm in my head. I'm neurotic. So I realize there are people so much smarter than me. And then I wanted to learn. So from that, you're not going to solve these problems in a day. So especially with kids, like I looked at like, what is resilience? What is post-traumatic growth? I can grow. What can I learn? So like Carol Dweck, read all these brilliant thinkers. Like I said, I want psychologist cards. I don't want baseball cards. And then our kids, the behavior we present around our children has a ripple effect that we may not think it's a big deal. But as I and you and all of us know, I may have seen my dad or mom and I joke around with them, but they are sometimes either scarred or developed in so many ways. And there are times that I've had to have some self-reflection and say, my kids would say, listen, when this happened with Uncle David, I was out of my mind. I may not have acted or behaved in a way like, how has my behavior impacted or not impacted you? And I want you to know, if you're not okay, like it's okay to not be okay, right? That's another book.
That's another great book.
But it's okay to not be okay. It's normal. It's okay to cry. It's okay to be disconnected. It's okay to connect. They don't use the words disconnected or not, but it's okay. Like, it's all okay. I just want you to know it is okay. And a lot of people will weaponize their grief. They become angry towards others. And like, that's one of the things I never wanted to do, especially with spouses, or friends, or anything else, because there's, I don't want to say no rationale, or it's not rational, but it's just raw. It is just so raw. Like, there is scar tissue that emerges from this. And then from that scar tissue, hopefully you build more connective tissue. But it's the commitment that I say is like, I don't know the answers. Life is worth living. I'm willing to put the work in. I think, like, I said that to myself, even when I was throwing up and couldn't get a meal down, I was committed to put the work in, to not to say get better, because there's no better, but to do the work of working through, acknowledge what I can, again, serenity prayer, what I can and can't control, and realize I don't know the answers. Like, I love saying this to my patients. I'm DMD, not GOD, right? I don't know all the answers, but really, this is going to sound crazy, but I learned more about life through death than I ever thought I would, if that makes sense. I learned more about living well. And I'm still learning this. I had some crazy health stuff in the year. I mean, all of these things, but like, what I did is I thought I was okay, but also, and you talk about this in your book, and it's like saying no to certain things is actually saying a deeper yes. So it gave myself the grace and permission. I call it the fit list. I get on the podium and I used to teach I still teach clinical dentistry. I teach surgery or parts of it and prosthetics. But I find right now, when I speak to dental and medical professionals, I'm speaking to about 1,500 to 2,000 or 1,000 people in San Antonio in the fall. A lot of people can learn clinical technique in the most great way. But if your mind and your body is not primed on a Monday to be so connected to that patient, then you're going to not only hurt yourself, you're going to help hurt others. Your team's going to be affected. It has so many ripple effects. So that self-care aspect is so important for people that operate in terms of compassion fatigue, that affects that we as professionals, we project that part of ourselves, but deeply inside, you may see me, Adam, is smiling, but I may be burning and crying and weeping inside in so much pain. And then when I go home and my team thinks I'm strong and I'm falling apart in a mess, if that is the true manifestation of where our head is at, then that's dangerous. Like, that's really dangerous. And like, I really wanted to understand how that paradigm and dynamic was going to affect me, my team, and understanding that, I think, made me okay. And I don't know, again, when I say made me okay, I'm not okay. I'm messed up. But I love my messed up. I love my brand of crazy, because it has allowed me to understand the human condition, what is important, and saying no and what isn't, and not feeling guilty and having that self-care of myself and saying, no, you know what? Sorry, I love you, bud, but I'd rather hang out with my wife tonight than like go hang out at a bar, whatever it is. You talked about with, I think it was like Ari Tucker, you talk about consent and resent, right? I love that. But it's the same feeling you get, but I love the framing of things. And that's what I think brilliant thinkers do, is that we all have these feelings, but how do I put words, language, framing? So yeah, that makes sense. Wow, I can actually look at this through a lens that makes me neurologically literate, psychologically literate, and being able to say, yeah, oh my God, there's a pattern here. I can identify that pattern, name it, name that part. And do I want that or not want it? Or say bye, or no, I want more of that. And being able to make those choices does allow any of us to live with more intention, clarity, identify joy, identify lack of joy, and things that connect and disconnect us.
And I love things that rhyme. There is a cognitive bias towards things that rhyme. That's part of how Johnny Cochran got off with the idea of the glove don't fit, you must have quit. But the fact is, if you can name it and tame it, and if you can feel it and heal it, both of those concepts, name and tame, feel and heal, have been really part of what you've done, Adam, in this whole process. And one of the things that I really think is amazing is you provided your children with a role modeling and a framework to realize as that great book is titled, I believe it's something, It's Okay That You're Not Okay, or it's not, I actually saw her give a lecture. She's an amazing grief specialist.
Awesome. Like I have a whole library of things that I'm like, these books saved my life.
Right. And we'll get into that in a sec, but I just love that you have basically taught your children that feelings do not last. We think that the feeling will be the same forever, but they are like a wave. They're ever changing. And it's kind of that King Solomon-esque idea of what he had on his ring, essentially, that this too shall pass. Doesn't mean that it will go away, but it means that it will change. And what you've basically were describing in the midst of your grief was, I'm overwhelmed. I'm absolutely under the wave. I'm underwater. I feel a thing that I've never felt before. I don't have words for it, and I'm not okay. And it's okay that I'm not okay. This is going to be changing, and I will be with this, and I will also listen to what I'm needing, and that is, you're a gregarious fella. You are an extrovert. You are not a lone wolf. You needed to be around people.
Yeah.
And you sought them out and let people know that would be helpful. You didn't suffer in silence and alone. You brought people in, which I think was probably, I mean, when you think about just how huge this was, again, not to assign a particular metric to this, but this was a big one. And you knew yourself well enough to know in some ways, I need to be around people.
Yeah.
I want to also talk about your
people.
Great people.
The right people.
The right people. That's right. People. That's a really good, good distinction.
People.
That's right. That's right. Not just anybody. Let's get into this though, because one of the things that I really admire about you is you have a great marriage. I got to see your wife, Mara, in the green room, and just seeing the two of you together just brings joy. One of the things that we know about grief, especially when it's really acute like this, is it can be harmful to a marriage. Yeah. It can also increase the bond. So I'm wondering, like, what worked between you and Mara and what maybe didn't work without me prying too much. I just want to know for the listener to be able to benefit from your wisdom.
I'm not that wise. I'm like the village. I'm like the village idiot with the and it's funny. It's like anytime anybody calls me doctor, I feel like I'm in trouble. It's like doctor. I'm like, that's my dad, right? It's so weird. Like, even I introduce myself to my patients as Adam. It's like I'm still the village idiot that laughs at fart jokes.
Just to justify my question, to honor your internal village idiot is the fact that wisdom can be gained from post-game analyses of good decisions and bad decisions. And just let's hear, what are some of the things that you learned from that experience?
So like Mara and I were always very close, right? We've been through quite a bit, but when anybody gets together in a relationship or a friendship, right? There is something in our brains that when you meet someone, you're like, I like this person, or I love this person. I want to get to know more. First time you meet somebody, there's something that's like, you either get that, the ick factor, wow, I really there's a feels. It's hard to put words to it, right? So Mara and I were married in 6 months. We were married in 6 months. I dated a lot of people. It was just like, nope, I don't know how this is going to work, but I could see myself living the rest of my life with you. I don't know. And everyone thought I was crazy. Mm-hmm. Jet was super supportive. So was David. But they were like, holy crap. But so Mara was my person. There was something about her that there was a fire, that we were willing to fight for things, but we also saw the whole human on our good and bad days. And the truth is that you name these people in your life that are anchors, people that you connect to, that make you get into that flow state of true presence and being, that you feel safe and loved, and you can equivocally do it. And it's not a bank account where you're like, I did these 5 favors for you, you do 5 favors for me. It's not and when you're angry at that person, you don't resort to ad hominem attacks, but you're angry that, but you can, my grandpa Abe used the word fight nicely, but you do it with respect, love, and decorum. you truly want the best for that person, not what you can transactionally get from them in terms of what a psychopath will do in order to get response. That psychopath will be, I'm going to act a certain way because I'm going to get something in return or a narcissist, psychopath, narcissist, whatever it is. But the whole point is that what worked was that when I couldn't do things for myself, she did. And I trusted and submitted to that process. And that's love. Love is not being able to go out and have a great time. Love is being able to be there for someone at their worst and being able to not push them, but to help carry that with them. We've learned a lot about our marriage. We've learned a lot about things, and that we can always go out and have a great time and laugh. And like Mara said, like her cheeks hurt, right? That's great. And that's the foundation for it.
By the way, listener, that's one of the things she said in the green room that was part of how she knew she needed to marry this guy, was because after a date, her cheeks hurt. But keep going.
When she and I are together, when she's gone through stuff and I've gone through, it is just, we want the best for each other, from each other. And it's not what you can do for me, but it's like, I want you to be the best version of you for you, not for me, just so that you're a caricature on a stage in terms of entertaining me. I want you to be the best version of you. And when you're not, I'm going to call you out on it. I'm totally going to call you on it. And there is safety in that. And like I said, without her, I don't know what I'd be doing. I'd be still the village idiot, but less of a village idiot. But like, there is that. And we all know that we have those friends. We have those people. We know those people. And the ones that aren't that way, that on paper are close, so you feel obligated, those aren't those people, or may not be. The list has allowed me to kind of really say, you know what? No, I'm going to speak my truth. And I think that's where we get in trouble sometimes, because we feel obligated. And again, it's complicated. I'm not saying it's easy, but with her, she made it easy. And I owe my life to this woman on so many levels of being a beautiful mother to our children. She helped me talk to her children about it when I couldn't even get words out. But I've done the same for her, not because it's owed, but because it's an honor to. And I think we both look at it in that way. It is an honor to. That's what I believe is true love. Every day, it's like, fancy word is bashert. Things are meant to be. Like, I truly believe like we were here put for each other. And I'm not just saying that because she's not even in the other room. Like, I truly feel it. I manifest it in everything. And sometimes when I suck and I've been really crappy to her, I haven't been so nice or cranky on a bad day, I feel bad. I'm like, wow, I was a jerk. And I'll call myself out for it even before she does. And even if she calls me out for it, I'll be like, you're right. So it's not about being right or wrong. It's about advancing that. And I think like that's what that true connection really, she's wonderful. I hope everybody has, not necessarily with a spouse, but people like that. They're like, those are the people that makes times like these. They make times like these, I won't say bearable. They make it so that you have a co-pilot to navigate, or many co-pilots, or your support team to not carry the burden, but just live in that space together, in that gray space that you don't necessarily know the answers, but it's just, you feel okay to be around them. That's your support team.
Beautiful.
Yeah.
Adam, how do you keep Dave alive? How do you keep him alive in your memory? The old idea of he may be physically not here, but the relationship continues. How does this relationship continue in your mind? How do you keep him alive?
So he's alive everywhere. I say this is that even like when he first died, I literally took everything from my hard drive, from my parents' photos, and like I wanted to build an archive of just for his kids, just so there's physical things, right? Those physical things. So that's why, but that's physical stuff. In my mind, I just tried to write down every good memory that we had. Even when I wrote, it's like I tried to write down memories, eulogies, so like timelines. Like, I'm not an author, but I said, if I were to write the book of Dave, I said this to myself, just write. Like, that was such a helpful exercise for me. And when I was done, I really connect with him through music. So I actually created a playlist called The Journey of things that remind me of Dave. So it's through art, it's through expression, it's just me. So all of those things. So I have music that connects me to Dave, songs that connect me to Dave. Like I'm speaking again this fall, and there's actually a exercise that I'm doing about connection to music and how it literally is like, so I tell people, I'm like, if you're ever stuck in grief or even stuck in a complication in an operatory or anything else, I said, we're not going to bite the lemon, but the metaphorical lemon is get up and walk. Get up and do, like, literally break the cycle somehow. Get up, walk, clap. Like if you do You clap your hands. What does that happen? It shocks the nervous system. So music is that for me. So it's connecting to him on so many levels, stories, connecting with some of his friends. So like people that he used to really be close with, I like to check in with them. They've checked in with me. So it's that, and I try to talk about him. It's hard, but it's hard for certain people. Some people don't even mention people at all. So, for example, his daughters were taken out every year for his birthday. He used to take them out. So I take his daughters out every year for their birthday now, like to a nice restaurant. We get dressed up. So it's like those things like that I do. So like we manifest. I do the best I can. I'm still struggling. I'm still struggling. I'll always be struggling. And then like basically what I say here is that there's something that is that basically the way that I don't want to say to people, look how I survived. It's that I become the embodiment of him in everything I do. Would my brother be proud? Am I proud of myself for honoring him? Is this in the spirit, soul, and essence of him? Who was he? Identifying that with that. And it's like, if he were looking down at me from the heavens, would he be proud? And am I being the best version of myself, or am I being a shithead? Would he call me out for this? Would he make fun of me for this in the way that Jed would rip on me or you would rip on me? Like those kinds of things. And it's like the Dave test, those things. And it's not just, this has to be so serious and you're honoring his soul and spirit. It's like this utter ridiculousness. And people would say like, oh, I still want to call my mother or my father or my brother. It's like, this is a moment I would totally text that crap to Dave. So it's like, I note it. It's funny. It's ridiculous. It doesn't have to be so serious all the time. There is some real catharsis in all of that.
That's gorgeous.
Yeah, man.
Adam, is there anything I should have asked but haven't?
If there's one thing I want people to leave with, it's that the floor is going to drop for all of us eventually, many times. Resilience isn't preventing that. And it isn't proving how tough you are. Hypervigilance, because I thought I built this huge fortress after Dave died, only to be broken down again. And we can do a whole nother show on that. But it's not about preventing it. And it is about proving how tough you are. It's recognizing how disconnected and knowing how to find your way back to yourself, to other people, the world, and something bigger, right? And we talked about this. And if I had to find my way back more times than I ever expected, I'm sure I'll have to do it again, that none of us reconnects alone. And then the North Star is basically when you feel like you're gasping for it, it's okay to not be okay and ask for help. And when you feel helpless, this will happen. It will happen again. You may lose control of your body and your mind. That's why we have care teams. Again, you have an infection. What? Here's the antibiotic, take the infection. There's a pill for that. It is so easy. It's a cause effect. With the mind, it is not as simple. With grief, it is not as simple. And we have medicine for all those things. So that's really what I would say, is to honor all of that.
That's beautiful. The final and magical question for you, Kimowitz, if you had the magic to confer upon all humanity, one insider skill that you believe would dramatically improve the lives of the individuals, and since we're all connected, perhaps those around that individual, what would that insider skill be? And how do you imagine it would improve the lives of the individual and perhaps even society at large?
I know this is so cliche, and I'm sure a million of your listeners will say it, but like empathy to yourself. First, be empathetic to yourself. Not I should. Should is like I should be better. No. But if you can be empathetic to yourself first, and I know this is like, we have to be empathetic. You can then start being empathetic to others. Start judging yourself less and giving yourself some more grace. And there's no timeline for grace. I think like, I know we say empathy, but really it's like empathetic to ourselves and empathetic to others. And then being able with that empathy, you will now connect not just to other people, but things you love, like music, like the art, what the world has to offer. Like for me, cooking, being present in something that matters to you most is that flow state, which is magical. So finding your magic first, I think, is that if the one thing is find your magic, whatever that is, your superpower, and do more of that and less of the stuff that really is your kryptonite. That's it.
Adam, this is way too cosmic for me not to bring up, but when you and I were talking on Monday night and we scheduled this meeting, I was on my way to meet my buddy whose name happened to be David. And he's one of the best therapists I know. And I was talking about how apathy is the opposite of love. And I still believe that, but he said, no, I disagree. And I said, well, what is it? And he said, I believe that the opposite of love is judgment. And you just said, stop being so self-judgmental and be more self-empathic. So you were talking about that as something that would move someone's ability to love. So it just feels so on point. Here I was with a guy named David, and we were talking about a guy named David this whole episode. And my man, may your brother's memory be a blessing for sure. I can tell it is. And I'm so grateful that you were able to share all of this, really, not the stuff that you wanted to learn, but the stuff that you had to learn. And to borrow from Sheryl Sandberg, you did kick the crap out of option B.
Yeah. And then I show one last thing at the end. So through music, I do a montage, and I'll share this with you. You may have seen it, of Eminem, of basically when I close my lecture out, of David, the song Beautiful Pain. So if you listen to the lyrics of that song and in the lyrics with Beautiful Pain, and then Armin van Buuren, I'm actually using for a lot of my stuff in my other lectures, there's such a connection to music that you feel it and you move, and that movement really just tethers you. So I actually showed a beautiful montage of David and all of that. So to that point, judgment, that beautiful pain is that when you release that judgment of yourself, you actually grow, you gain, you become more connected with yourself, and you get to really learn. I don't want to say the meaning of life, but you get to experience the joy in that flow state of being present with what matters most.
Thank you so much, Adam.
Yeah. Love you, bud.
Love you right back. This is Dr. Adam Dorsay thanking you for listening to SuperPsyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.